I'm Dr. Robert Applebaum. I'm a plastic surgeon in practice in Beverly Hills. I'm going to take a patient of mine through the entire process of evaluation, through the laser treatment and the recovery time, to demonstrate to you the effects and the results of the DECA CO2 fractionated laser system. Hi, Michelle. I'm Dr. Applebaum.
Nice to meet you.
We're going to talk a little bit today about the DOT CO2 fractionated laser system. And I believe you're a very good candidate to have a laser resurfacing. Tell me a little bit about your skin and some of the thoughts that you have that maybe laser could help you with.
People used to tell me I had gorgeous skin, really nice, flawless skin. And like I said, I've spent a lot of time in the sun, so there's been damage. And I don't look like I have that kind of skin anymore.
Let me talk to you a little bit about the laser and some of the areas that I think you'd have some very nice improvement. If we take a look at certain areas here, I'm going to hold up a mirror. You have some dyschromia here, some discoloration with sun damage, a few areas of crepey skin, some lines, some vertical lines here on the upper lip, some sun damaged skin and with some crow's feet and some crepey skin here, and a little bit of forehead, in the forehead area, some vertical lines. Your skin is not terrible, but it definitely has been exposed to the sun, and I believe the laser will significantly improve the appearance and the texture and give you some nice firming and tightening.
What is the recovery like with the laser?
The laser has a recovery time of several days. I would say between 4 to 6 days, depending on the depth that we're going to go. This is much improved over previous laser resurfacing systems that often took a week to 2 weeks and had prolonged redness. So you're going to have peak swelling at 24 to 48 hours, with peak redness probably around 48 to 72 hours, and then it's going to taper off dramatically and you'll have pink new skin at that 4th to 6th day.
What is the procedure like? Is it very painful?
The procedure is done under local anesthesia most of the time, and we're going to apply a topical anesthetic to your face for about an hour and really let it get numb. And we're going to apply it to the face and also to the neck and the chest, and then we're going to take you back and do the laser, and you should not feel anything with that treatment.
How long does the procedure take?
Most of the laser procedures, if you're doing the face, the neck, and the chest, take about an hour to complete. Following that, we're going to put lots of cool compresses on your face and cool you down a little bit, and then you'll get up and leave. And the beauty is that it's all under topical anesthesia.
How am I going to take care of my face that first couple days after the procedure?
We are going to recommend, and we're going to insist that you put on a very thin coat of Aquaphor on your face for the first 2 to 3 days. Then you'll ease into using a light moisturizer and cleansing with a very gentle cleanser.
I feel that the results that I saw were pretty phenomenal, and it's pretty hard to tell with my skin because I've been taking care of it for over 23 years since I've been in the business. So I feel that this is something that is really, I mean, if you're really looking, you know, to get rid of the damage and what you've done to your skin in your early days, the CO2 fractional pixel is the best thing I've seen in the last 15 years.
The application of the topical will start taking effect in the next 5 to 10 minutes, and your face will get number and number as the hour goes on. We're going to do a second application of this in about 30 minutes to get the deepest possible anesthetic effect. Okay, we're good. Very good. All right, we're going to let you numb. All right, we're going to go ahead and test the laser on the tongue blade. Our setting is at 27 watts, a spacing of 300 microns, and a dwell time of 1100. Here's a spacing of 600, and you can see the difference, how we can make it more or less dense.
Yeah.
How we doing?
Okay.
All right, we're going to start the treatment. Okay, here we go. How we doing?
Okay.
Good. So the idea here is to line these squares up side by side with minimal to no overlap. Going all the way up into the hairline, just right at the hairline there.
It feels like you're drawing lines on my face.
It feels like I'm drawing lines. Okay.
Yeah.
Well, we're drawing squares.
Square.
Definitely drawing some squares. Use some alcohol to clean it a little bit. There you go. The important aspect of this technique is to make sure that the laser light is perpendicular and that you're not off to the side, this way or that way, that you're directly laying both metal elements right on the skin, and that gives the most consistent treatment. We're going to do her crow's feet now. Now I'm going to take the size and diminish it a little bit. See, we're going to go from down one size. You can see the ease of use of this laser. Sometimes gently pulling on the skin here to retract excess skin. So I'm doing a second pass at the same setting on the upper lip, because she's got some deep vertical lines there that will help. So we're done with the face. And what I like to do at this point is start putting cool compression on. So I have iced saline, and we're going to go ahead and layer a number of iced saline gauzes on and start the cooling portion of this procedure. So we've now completed the forehead, the eyes, the cheeks, the neck, and go ahead and open your eyes a little bit. There you go. There you are. Look at that. Okay. So here's what we're doing. We're just putting some light aquaphor on this area, kind of patting it in and gently, distributing it over the areas here. And that's it. We're going to get her dressed, and out she goes. She's going to be good. Michelle just sat up. We just finished the procedure. She's had some ice. She has aquaphor on. And you can see that immediately post-procedure, there's not a tremendous amount of swelling there. She has the light coat of aquaphor. We're going to get her dressed, and she'll be on her way. All right, Michelle, you did fantastic. So we'll see you in 2 days for a post-op check, and you're on your way with your post-op instructions.
Thank you.
Okay, see you soon.
Bye.
Hi, Michelle.
Hi, Dr. Applebaum.
All right, so we're our second day out, and good to see you. So let me ask you a couple of questions, see how things are going. Tell me a little bit about how you're taking care of it.
I'm lightly washing it with baby wash and then putting some aquaphor on it to keep it moist.
Terrific, okay. And at the second day here, are you having much discomfort now?
No,
Okay.
very little.
Very little. So really it was the first 24 hours that you had, tightness, pain, and some burning.
Yes.
Okay, terrific. Yeah, I mean, I would say that your swelling at this point is very typical. You got the puffiness around the eyes. You see a little bit of exudate there. But for the most part, you look right where you should be. The neck is, just to point out a little bit, the neck is always a little bit more red, a little darker. The face tends to stay a little pinker. And so the color is right where you should be there.
I like this color.
You like that? Oh, that's a good color. It looks good on you. So we're 3 weeks out. I'm seeing a noticeable difference. How do you feel about the result at this point?
I'm really happy with it. It's nice and even and smooth. The brown spots are gone. I'm really happy with it.
Good, good. So I'm just going to kind of take a look and see you know, some areas of some significant correction here. I mean, this cheek that had a tremendous amount of sun damage and discoloration and dyschromia is cleaned up very, very nicely. The skin looks very smooth. Over here, there was a lot of discoloration. The lines have lessened here. It still looks natural, but yet you have some minimal smile and minimal animation lines. Even some of the deeper areas on the lip, although albeit we didn't get rid of everything, have been, you know, significantly improved there. And actually got a little tightening in the jowl area through here and this area with the marionette line. Tell me a little bit about the last, you know, week and the recovery. Did it go pretty smooth, and did you feel like, you know, you were moving along at a good pace?
It actually moved pretty fast, and it was kind of like a sunburn, and over the days it felt better and better and better, and then it just went away.
Okay. And you're wearing sunscreen now, and you're protecting your face, you're wearing a hat, and you're doing all the necessary things to keep this result up?
Yes.
Okay, so you're a changed woman.
For the most part.
For the most part, all right, good. You've now had the opportunity to follow one of my patients through a complete laser treatment. It involved seeing the patient preoperatively, understanding what her desires were, what her expectations were, following her through the laser treatment and into the recovery, and seeing her finally at the end with her result. I believe that the CO2 DECA fractionated laser system is a significant breakthrough in facial laser resurfacing. This system will allow you to resurface patient's skin, whether it's for acne, pigmentation, aging changes, sun damage, or even wrinkles. You will obtain results that are very similar to prior laser systems that had recovery times that took weeks to months. With this breakthrough, I believe that this laser will become a standard tool and will change the way physicians resurface skin.